first one is, I had a CT scan about 3 years ago, which identified small AVMs. I had no symptoms at the time. I've started to develop symptoms recently. I'm not due for a scan for two years or more. Should I look for a scan sooner?
Thank you, Michael, and thank you everybody for sending in such interesting questions. There are a lot of them, and a lot of them are very relevant, and I'm very happy to deal with as many of them as we have time to do. Firstly, I don't want to get into a situation of doing individual patient consultations by Zoom, because obviously we don't know precisely what individual people's circumstances are at any given point in time. But it would depend, to the person who asked that question, it would depend hugely on what your symptoms are. We'd have to look back at the individual record, look at what PAVMs you had, how small they were, and know what your individual symptoms are. Those symptoms might have nothing to do with PAVMs, they might. So beyond that, I really can't comment.
Okay, thank you. I'll go on to the next one. Do you recommend any preventative treatments for migraines as a result of HHT? And is it possible to detect migraines from HHT directly?
No and no is the answer. Firstly, the treatment one would have for migraine, whether it's related to your having HHT or not, will be the same. So I'd consult your own doctor or the neurologist or whomever you're seeing to manage that and ask their advice. It's not that the migraines that one gets from HHT are qualitatively different from migraines that somebody who doesn't have HHT might suffer from. It's simply that the risk of your having it goes up a little bit. We know the biochemical reason for that, and you can go into the science behind it, but it has to do with certain chemicals not being processed in the lungs and passing through PAVMs. So the way migraine is treated is the same whether you have HHT or not. But if you have HHT, statistically, you are at a greater risk of suffering from migraines. And we know from the literature that managing PAVMs, embolizing them if they're big enough, can reduce that risk to that of the general population. There isn't a preventative treatment that is specific to HHT people, nor is there any screening test for migraines related to HHT, just an association.
This is a pretty big one, and you could spend all day talking about this one, but how can our families help our GPs to recognize and diagnose HHT, and where should we refer them on to? I know that's a big topic. It's not an easy one to answer.
Well, we rely heavily on family practitioners to help us with referrals and to triage people. A lot of people who have nosebleeds, for example, and are aware of HHT would be interested in knowing whether they might be related. We fall back on the clinical criteria, the 4 diagnostic Kurosawa criteria for making a clinical diagnosis of HHT. We have information, we have brochures that we produced many years ago that we can make available to GPs. All of this information is available on the HHT Ireland website as well. So if you're worried about it, I'd say talk to your GP, bring any information you may have gleaned from the website to them, let them consider with you whether or not you fit the clinical criteria. If they think you do, then referral to our Centre for Screening in Cork would be what we'd advise.
Okay, great. The next one, we're probably going to cover this in the breakout room, but the question was, does Dr. Brady or his team have a list of HHT specialists that he can share with us? It'd be great to know where they all are.
Depends on what your manifestation is. We don't keep a list of people who are in or who are out, if you like. ENT surgeons, interestingly, are very commonly the people who first see patients with HHT because the first manifestation that people become aware of and seek medical attention for would often be nosebleeds. So ENT surgeons are probably most plugged into this diagnosis, but are often focused on the nosebleed aspect of it. What we're trying to do all the time is increase awareness of the bits that are more dangerous that we need to screen for. So we don't keep a specific list of specialists, but we are aware of people who have interests in HHT manifestations in their own particular specialty, and we do link in with them for specific patients as necessary.
Okay. Question here, is it okay to exercise with small PAVMs?
Absolutely. Most people who have HHT and have small PAVMs should not restrict their life other than not scuba diving in any way. You don't have to protect yourself by not exercising aggressively or doing whatever you want to do. You're not going to increase your risk of an unfortunate or unpleasant event by taking exercise. Don't wrap yourself in cotton wool, essentially. If you have very large PAVMs reducing your exercise capacity, then obviously we want to know about you and we'll do our best to help you. But small PAVMs, live a normal life.
Okay. Has anyone ever tested positive for more than one of these genes?
Not that I'm aware of. I can imagine it might have happened, but on a statistical basis, it would be extraordinary to have more than one of the mutations that affect the same common pathway. But I'm sure it can happen. Statistically, anything can happen.
Okay. Here's one. I tested positive for HHT, but my genetics are still being tested as they find a link to lymphoma. I've been given a mutation. I have been given a mutation, yet I'm on apixaban, blood thinning drugs, and I've had first vaccine of Pfizer with no problems.
Yeah, again, I don't want to get into individual patient circumstances other than to say that when one has a full genetic profile done, all sorts of mutations will inevitably show up. We all carry mutations of one form or another, most of which are inconsequential. It's quite conceivable that somebody might have one of the mutations associated with HHT and have another disease going on, which might be associated with another mutation. So I don't know the individual background here. In terms of being on apixaban, again, there would be another reason for somebody being on a blood thinner such as apixaban. I'm glad to hear that that patient has had no problems with the first dose of vaccine. I would have thought it extremely unlikely they would anyway, because they use a tiny needle to give these vaccines, and the likelihood of local bleeding would be very, very small.
Okay. Here's one that worries people a lot is, can CAVMs grow after having a negative screening result?
To the best of our knowledge, they do not. We rely on international literature and research that's been done over the years, and that would all support the single screening MRI brain strategy that we use. It seems that these are either present or not present. PAVMs are a little bit different. They do tend to grow with time, but to the best of our knowledge, CAVMs do not appear having been absent on an initial screening test.
Okay. Given the treatment for blood clots that can cause increased frequency and severity of nosebleeds, does this cause Dr. Brady to consider that the vaccines implicated in blood clots should be avoided by HHT patients?
Yeah, I'm not surprised that there are lots of questions about vaccines and the blood clotting concerns that have been raised in the literature. The answer is no. There was some interesting advice that I saw only yesterday that emerged from NIAC, which is distilling all the international research that's presently available on this. And it essentially said that if you've had the common type of blood clot that patients often experience, a DVT in the leg or a pulmonary embolism, which would be a little bit less common, that doesn't mean you're at an increased risk of the dangerous clots that are associated with the adenovirus type vaccines. There's no statistical association. So if you've had a DVT for whatever reason, and the common reasons would be someone who's had immobilization, maybe a long international flight, there's an increased incidence in women on the oral contraceptive pill, for example. Those people have a statistically higher risk of having these very specific types of clots that are associated with the adenovirus type vaccines. And those are cerebral venous sinus thrombosis, so a clot in a vein in the brain, or splanchnic vein thromboses. So that would be a clot in the veins that drain from your gut. So there's no increased risk for these people. Now, I'm not sure if that answers the question that's asked fully.